Let's talk about this. The CDC is reportedly considering loosening its coronavirus isolation guidelines this April, letting people determine when they can head back into the world. According to the Washington Post, the new proposed guidelines will say that people no longer need to isolate once they have been fever-free for 24 hours and their symptoms are mild or improving. The Post cited 4 unnamed agency officials as the White House has not signed off on this guidance. The CDC last changed its policy on isolation in late 2021 when it scaled down the recommended period to 5 days from 10. Locally, medical experts are advising you to continue isolating until the federal guidelines are officially changed. Americans who test positive for the coronavirus may no longer need to stay home from work or school for those 5 days. The CDC, again, planning to loosen those guidelines come this spring. And Dr. Geraldine Luna is the medical director for COVID-19 response with the Chicago Department of Public Health and director of MOLA, joining us now to discuss this. Thank you so much for being with us.
Thank you for having me.
Let's start with this. Obviously, this has not been given the stamp of approval federally. What is your take so far on if these guidelines are loosened?
Of course, every time we see a change in guidelines, it's data-driven. It's the first thing to ensure safety and minimal interruptions of infrastructure that is essential and critical service to the public. So if this happens, which is not yet the case, that would be based on science to support it. The most important thing is that families and friends out there don't take their masks if you're sick or you have conditions at risk. Please continue 5 days of isolation because so far it has proven to be the highest 5 days of infectivity. And if you're feeling much better, fever-free, by day number 6 and 10, continue to apply again, go back to work, go back to your essentials, but always using a mask to protect dissemination of disease, others from dissemination.
So even though those guidelines may loosen, you still should probably mask up is what I'm hearing you say. Let's talk about what we're seeing in Chicago. Are we still seeing cases, because I know not too long ago we were reporting that coronavirus was up in the city of Chicago. Are we still seeing cases of an increase?
Yes, and we saw those increases in December, but fortunately we're seeing a downtrend of cases. That is in hospitalizations, and we haven't seen mortality change much, fortunately, compared to those times COVID-19. But we still have here in Chicago 20 cases of hospitalizations per day, driven by COVID-19. So although we're optimistic, we're cautiously optimistic, still recommending do your due diligence, wear your mask if you're at risk. Most importantly, get vaccination. We're seeing those numbers drop compared to previous times in COVID, and they're still for free, completely for free. And continue to etiquette. Wash your hands continuously, frequently throughout the day. Cover your sneezes with your elbows, and most importantly, stay at home if you're sick. We still recommend those 5 days of isolation of COVID-19, the most part, and by day number 6 to 10, please wear your mask to avoid dissemination of the disease.
Dr. Luna, when I hear that and I see that, I'll tell you, I become a little concerned as a parent when it says people no longer need to isolate once they have been fever-free for 24 hours and their symptoms are mild or improving. And the reason being is because during the height of the pandemic, that was some of what we heard, that people didn't show symptoms necessarily. What do you say to parents that still have to send their kids to school and in environments where you may not know that people actually are infected with COVID?
Of course, and we're seeing a lot of individuals just flexing those recommended guidance. And I would highly recommend, if you're sending your kids to school, you're feeling sick, just stay at home with your children, make preparations, make sure they're home, give them love and tender care, make sure they're wearing their mask if they're around people with high risk of severe disease, and do the COVID testing as soon as you can. If you're an individual at risk, and you test positive for COVID, remember there are medications out there that decrease significantly the course of the disease and prevent from hospitalizations and death. So we do have the tools. We are functioning very well with the tools, but we're missing out important parts of getting vaccination, increasing your protection. And the vaccine that we have now is new, completely new to the variants that we have circulating out there. So it provides highest protection ever.
You
So
have given great
just don't
advice.
get bit. Yes.
All right, Dr. Geraldine Luna, we've run out of time. Thank you so much for joining us today on First Up 4.
Thank you for having me.
All right, it's a pleasure. Sylvia, I'll send it back to you.